Uh, Good morning, everyone. Thanks for taking time to listen to me. I'm Harsh, the CEO of Moving Analytics. We help hospitals implement home-based cardiac rehab programs. Let me tell you about the problem that we solve. This is Joe. He just had a heart attack. And after his heart attack, he's prescribed cardiac rehab to improve his cardiovascular fitness. If Joe does rehab, he doubles his chance of living another 5 years and cuts his risk of readmissions by a third. But there's a problem. There are 4.5 million patients like Joe every year, and less than 20% of them enroll in rehab. Because to participate in rehab, a patient like Joe has to visit a hospital 36 times and spend about $2,000 out of pocket as copay. So he doesn't go. This is bad not just for Joe, but for hospitals too. Because with the coming of bundle payments for cardiac care, hospitals will be on the hook for up to $2.5 billion in readmission costs because their patients don't do rehab. So hospitals are really looking for ways to increase access to rehab, but are limited by the current delivery models, which require a lot of infrastructure and nurse commitment. So that's where we come in. We help hospitals implement technology-enabled cardiac rehab programs that their patients can do from the comfort of their homes. We're based on a program called Multifit, a home-based care management system that was built at Stanford University and validated in the Kaiser Permanente medical system on over 70,000 patients. This program was shown to reduce readmissions by 40% and have a 90% completion rate. What we've done is we've taken that program and we've digitized it into a care management system for nurses and a mobile app that patients can use to receive rehab in the comfort of their homes. So how does that work? When a patient is discharged, his nurse creates a customized care plan and helps him download this plan on his tablet or smartphone. At home, the app guides him through daily rehab goals and reports his progress back to the nurse. Once a week, the nurse and the patient have a phone call where she goes over his care plan and then modifies it based on his progress. This program goes for 12 weeks. For this service, we charge $300 per patient, and at 4.5 million patients a year, that's a $1.3 billion market opportunity. And the value proposition is that we help hospitals deliver quality care to patients from the comfort of their homes. And on a per-site basis, we can help them save up to $3 million in readmission costs every year. And this has really resonated well with our clients. Since starting last year, we've signed over 10 hospitals and have another 10 on the way, including marquee names like Mayo Clinic, the VA, USC Keck School of Medicine, Langone Medical Center, and many more. We've also won a number of awards, including an award from the American Heart Association for being one of the most innovative companies in heart health, and from Philips for being one of the top companies in wearable health. In our early studies, we've shown that we can improve functional capacity by 50%. And have a 95% satisfaction rate and an 80% completion rate, showing the quality of our solution. And this is possible because of our amazing team. Our executive team has designed over 20 world-class products as part of multiple startups. Our clinical team is widely considered by the cardiology community to be one of the world's most foremost experts in home-based chronic disease management. They're formerly from the Stanford Cardiac Rehab Program and now work for our company. Between them, they have experience in implementing home-based rehab programs across 20 hospitals across the nation. There's a lot more that I can say, but I'd like to end with this thought. There are 3.5 million patients like Joe every year who are basically discharged with 2 sheets of paper once they leave their heart surgery room. The shocking fact is that those patients don't get a shot at an additional 5 years of life. And I'd like you to think to yourself, if you have a loved one who's had a heart attack or you might be at risk of one, what is 5 years of life worth to you? The time spent with your loved ones, the families, the vacations, the anniversaries. That's what we're fighting for, and that's what keeps us up every day. And so once again, I'm Harsh, Moving Analytics. If you're a provider or would like to speak to us, we'd love to be able to talk to you. Thank you, and have a great rest of your day.